We all struggle with feeling like there's not enough time in the day to be productive personally or professionally. We all struggle to make our time matter. It's time to take control. It's time to start investing in the corporation of you. At Athena, they've helped over 700 ambitious professionals achieve more by connecting them with best-in-class, globally remote executive assistants. Athena executive assistants go beyond basic administration tasks. They help you make time matter through the art of delegation. They believe delegation is the superpower of all highly successful people, and your personal EA will help you get there. Your EA is a one-on-one long-term partner to help you achieve your personal and professional goals. Take back your time. Join the waitlist at athenago.com. That's athenago.com.
My favorite thing about working in healthcare is the people. This industry brings together brilliant, highly motivated individuals who are driven by the opportunity to make a difference. My name is Hallie Tecco, and this is The Heart of Healthcare, a podcast where I'll be introducing you to the people on the ground moving the needle in public health and medicine.
The number of people dying in car crashes is on the rise, and public health officials say the pandemic is partially to blame.
In the first half of this year, an estimated 20,000 people were killed in traffic crashes. That's the highest number since 2006, and 18% higher than the same time last year.
Each year, motor vehicle crashes take the lives of more than 40,000 people in the U.S. and result in 2.7 million emergency department visits. This summer, I was one of those ER visits after being hit on the freeway by a drunk driver at 1 p.m. on a workday. It was the scariest moment of my life, and I'm just so grateful to be alive to talk about it. The thing about car accidents is that they are no accident. They are completely preventable events. But reducing them requires collaboration between car manufacturers, policymakers, the justice system, and the healthcare system, which deals with the aftermath. There are people working at this intersection, pun intended, who have dedicated their lives to making our roads safer. And today I'm excited to introduce my guest, Debbie Hersman, a transportation and safety expert. She was previously Chief Safety Officer and Senior Advisor to Waymo, Google's self-driving car project. Before that, she served as the CEO of the National Safety Council, as a board member of the National Transportation Safety Board, and was nominated by both President Bush and President Obama and unanimously confirmed by the Senate 4 times. Debbie, I'm so excited to talk to you today. Welcome to the show.
It's great to be with you, Hallie.
So, car crashes are a leading cause of death for people under 55 and cost us $463 billion in wage and productivity losses, medical expenses, admin expenses, property damage. So, okay, why does this feel like the really last problems that we've discussed in healthcare?
So it is crazy that this is one of the last things we talk about when it comes to healthcare, because it's actually the third leading cause of death in the United States behind heart disease and cancer. In 2020, we actually are going to see it move to the fourth leading cause of death behind COVID. But we actually know that that number of fatalities on the roadway will be much higher than previous years. We've seen those increases during COVID on the highway fatalities. And so that's actually a concern. I know we'll talk about that in a minute. But I think one of the reasons why we miss talking about this is because of complacency. These deaths have occurred for decades. They're considered to some extent like random events. They may occur one death at a time or two deaths at a time. We very infrequently pay attention to this as top of the news. And I think we're just very complacent about these fatalities. But I can't tell you how many families have been impacted by this through the years. It's hard to talk to someone without hearing a story of someone that they've lost. Even our president had lost his wife and child in a motor vehicle crash. So these are high visibility events. They occur to a lot of people, but we've become a little bit complacent about it and almost accepting of it.
Yeah.
But we don't need to be.
Yeah, it's almost like cars are just so American. It's this American innovation that we cherish, and people love their cars. I wonder if there's like a protective factor that any sort of complaint against cars is like an insult to America or something.
Well, they clearly were kind of a sign of, our growth, and they're a sign of independence for individuals. But, when we look at like teen driving fatalities, if you told parents in exchange for having this independence and this ability to get around, we're going to have to take, 2, 3, 4,000 lives a year, most people would not be okay with that bargain. But somehow we kind of accept these fatalities as the cost of mobility.
Yeah. Well, my 4-year-old is obsessed with cars, and every car that drives past us, he'll be Buick, Lexus, BMW. He can name every car. So we're already telling him, you're not going to be able to drive at 16. You can look at the cars, but there's no way we're letting you behind one. And my husband and I just hope that there'll be, autonomous, safer options by the time, in 12 years.
I've got 3 boys. 2 are drivers and 1 is in the learner's phase. So, Hallie, I can completely relate to your fear, your 4-year-old, but it gets worse as they get older.
I know. I actually think back to, so my first car was I'm not this old, but my car was old, was a 64 Mustang. And this is when the seatbelts were really just around the waist. I can't believe my parents let me drive that car.
That's a pretty cool car for a first car.
It was a very cool car. My dad's a old car guy, so we fixed it up, and it was a meaningful car. But I would never let my child drive that. I wouldn't even drive it today. So you said that there's been an increase in traffic deaths during COVID, even though Americans drove 13% fewer miles. There was a 7.2% increase in traffic deaths. And that's the highest fatality rate that we've seen since 2006. What happened?
So this is actually the opposite of what we usually see. So generally in a recession, you have fewer miles driven, and that actually translates to fewer deaths. But that's not what we saw in the last year. So there's a number of different factors that could be impacting this. And so one of them is we had fewer cars on the road during 2020. And so it actually resulted in the cars that were on the road driving at higher speeds. Another area that people cite is that enforcement interventions like click it or ticket campaigns were suspended during COVID. And another interesting fact is NHTSA started a study right before the pandemic in multiple cities testing for drugs in drivers, looking at the percent of serious injuries, the percent of ejections, things like that. And so what we actually saw was once COVID started, because we had some data points prior to COVID, once COVID started, we actually saw an increase in a lot of risk-taking behavior on the roadways in these 5 studies, in these cities that they were studying. The percent of severe injuries per car crash increased, the percent of injections increased, and there was a particular spike during the first few months of the epidemic. And so we saw everything from seatbelt use, which dropped 4 percentage points from pre-COVID levels, to motorcycle helmet use, which was worse by 14%, to impairment increase in the study. And so alcohol impairment went up. There was a lot of talk about people drinking more during COVID, and we actually saw that on the roads too. But we also saw more drug impairment and more multi-pharma impairment. Interestingly enough, they also tested the people in the study, and about 8% of the serious injuries and fatalities were positive for COVID. So, there's a lot of data out there. So, I think we're still trying to make some sense of it. But I think it was probably a perfect storm of lower enforcement, higher speeds on the road, and probably more some of this risk-taking behavior that we saw in the study. But it's a bit early to tell, but those are some interesting data points.
Yeah, that rise in unemployment, and
Yes.
depression, anxiety, that all leads to, risk-taking behaviors. That's too bad. That's really sad.
I think it's just another example of the cost of COVID for
Yeah.
society, for sure.
Well, and I mean, these emergency rooms need no more patients, so it's really too bad. Well, let's talk about the safe system approach. What is that?
So, a lot of times people compare different modes of transportation. And so I'm going to use aviation as an example. We can go for years in the United States with millions of employments every year and have zero fatalities in aviation. Now, there's just as many moving parts, lots of complications in aviation. You have different pilots, mechanics, air traffic control, you have different companies, you have different aircraft types, you have weather, you have different airports that people have to land in, some that they may have never landed at before. So you have all of these factors, but in commercial aviation, we've been super successful. We haven't had a commercial aviation fatality involving a US carrier in the United States since 2009. And so how do you do this? What they did in aviation is they really looked at taking a systems approach to this. They looked at how do we improve reporting, disclosure of failures, whether it's human failures or mechanical failures, aircraft issues. They looked at a lot of issues. They got cooperation from the manufacturers, from the operators, from the labor unions, from everyone, and they all worked to try to solve this problem together. One of the things that we haven't done on the highway safety side is really take a system approach to this. And so there are a few things that are really important in a safe systems approach. We need to think about the safety of the vehicles. And so ensuring that we have vehicles that have the best safety technology that perform the way that they're designed. We have to address safe speeds. This is one of the biggest factors in serious injuries or fatalities. The higher the speeds, the more likely you're to have serious injuries. And the higher the speeds on roadways where you have vulnerable road users like pedestrians and cyclists, again, the worse the outcomes are for them. So speeds need to be appropriate for the environment. Safe roads, so having good design of the roadways is really important. We'll talk a little bit more about that later, I think. But good post-crash care, so important to understand that what happens in that golden hour when a person is injured in a collision. Emergency responders quickly have to locate them, stabilize the energy, and transport them to facilities. And level 1 trauma centers make a huge difference when you're talking about serious injuries or potential fatalities. And then safe road users, making sure that everyone on the roadway is safe, whether they're walking, driving, riding, or using other modes of transportation. So there's a lot of factors here, but I think that that's one thing that we've missed on the highway system. We kind of get compartmentalized and have a lot of silos, whether it's highway engineers or whether it's car manufacturers or others, but all of us need to work together in a holistic way to anticipate that humans will make mistakes. That is going to happen. Humans are vulnerable. We will get hurt if we're involved in a collision, that we all have responsibility, and you've got to have redundancy to strengthen the system. And so those are some of the things that have been very effective in aviation to be able to trap errors before they result in fatalities.
So I'm furious when someone drives by me and they're texting on their phone. And I'm curious what's actually more dangerous, being distracted on your phone texting or drinking and driving?
Yeah, so that's a good question because both are bad. I would say if I could tell people don't do either one of them, and certainly don't do both at the same time.
Oh my gosh.
But I say in general, the data really isn't that great to compare the two. And so when we look at fatality numbers, 10,000 people a year are killed in alcohol-involved crashes. And that number's been pretty consistent over the last couple decades. We don't do a great job counting the distracted driving events for a number of reasons. There's mandatory testing in a fatality where you have to get tested for alcohol. Distraction, people don't turn state's evidence on themselves and say, oh, I was texting and that's why it caused this crash. We also don't really have the forensics authorized to say, check their phones to make sure they weren't texting. I mean, occasionally you'll get search warrants or things like that in cases, but in general, we don't know. So they attribute about 3,000 fatalities a year to distracted driving, but we know there's significant underreporting in that area. The problem with alcohol, if you're impaired your entire drive. If you're distracted, it might be a little bit more episodic. So you're not doing it the whole drive, but we know from roadside observations that about 6% of drivers are manipulating handheld devices at any given time. This is just from roadside observations. So again, there's things that they miss if they can't see the phone, things like that. And, for me, anecdotally, that's what the data says, but I often feel like I'm paying attention and it seems like more people are distracted when they're driving.
Yeah, it's pretty scary. And that's certainly, even though we've advanced in car safety, we've also advanced in these mobile phones that are just always on us. And that sort of communication is something that 30 years ago didn't exist. So it's like alcohol has been around for as long as cars have, but iPhones are relatively new. And so I wonder how we can kind of catch up with that.
And it's worse as the generations get in the car because they've always had cell phones, right? And so they've never been separated from their phone. And in fact, I think the problem is probably a little deeper. And to me, it's very uncomfortable because cars actually now connect you to your cell phone. And so it is very difficult, right? You're using your phone for navigation or for other things, and you're constantly getting pop-ups for text messages. Voice to text, the data shows us, is not any safer than texting by hand. People are distracted. It's not your hand that's distracted, it's your brain. And so some of these voice systems where people are like, oh, it's okay, I'm hands-free. It's not your hand that's distracted. Again, it's the lack of attention, that you're dedicating to the task. And so missing cues, getting tunnel vision, not seeing out of the periphery, not paying attention. We've all had experiences where we've lost focus, but that happens pretty consistently. And studies have shown that voice systems are not safer.
Yeah. Well, I do want to talk about what is safer, but before we move on to kind of the solutions, I want to talk about how Black Americans experience a higher rate of traffic fatality. I don't understand why we would have those disparities. Do you have an understanding of why race comes into play here?
Yeah, so I think there's a lot of data that can inform some of the things that we understand about this. The pedestrian fatality rate is nearly twice as high for African Americans as it is for whites. But it's important to understand that there are a lot of groups, in addition to African Americans, that are disadvantaged. For Native Americans, it's actually 5 times higher than whites. Older adults also experience higher rates of pedestrian fatalities. For those 50 and above, it's about a third higher than the general population, but it jumps to twice as high for people 75 and older. And so for African Americans, they're absolutely seeing higher fatality rates than whites, but there's a number of other groups who are similarly disadvantaged in that safety space. And so we want to kind of try to capture as many of them as possible in the fixes that we make. So consider some of the factors. Lower income neighborhoods experience twice as many pedestrian fatalities as those with highest incomes. And the overwhelming number of pedestrian fatalities occur in urban areas, about 8 out of 10 of them. Some of the environmental things that we know about pedestrian fatalities is they occur more at night in dark lighting conditions and on the weekends. And then 42% involve either impairment of the driver or the pedestrian or both. But when we think about low-income communities, they have poorer design of their roadways. And so they're at greater risk. Low-income drivers are often driving older cars. And so they don't have the latest safety technology. So there's a number of factors. It's fairly complex, but I would say low income for sure has a clear disadvantage when it comes to roadway safety. And then I'd say urban environments for pedestrians are also much riskier.
Yeah. Another way that our built environment impacts our lives. What about,
exactly. Yeah. This is a huge topic and has gone on for decades, where we have created, we've put roadways, we've put interstates, broken up communities, created high-speed traffic through communities. There's a lot here to unpack.
Mm-hmm. Okay, so what about women? How are we at a disadvantage inside the car?
Oh, so this one is such an interesting conversation. So although the majority of Americans that are killed or injured in car crashes are male, the raw data masks the fact that females are actually at a greater risk of death or injury when a crash occurs. So data from NHTSA, the National Highway Traffic Safety Administration, and the Federal Highway Administration show that males drive more miles than females. They're more likely to engage in risky behavior like speeding, driving under the influence of alcohol, or not wearing a seatbelt. But a study from NHTSA shows a female driver or a front passenger who is wearing her seatbelt is 17% more likely than a male to be killed when a crash takes place. And then there was a 2019 study from the University of Virginia that shows for a female occupant, the odds of being injured in a frontal crash are 73% greater than the odds for a male occupant. And that's when you control for the age, height, collision severity, and vehicle model. By the way, there are similar findings for older adults. Their bodies experience crash forces differently. And so differently than what? And so one of the really important things to understand is vehicles are designed to tests. And so there are crash tests and vehicles have to perform. And so that's where you see these safety ratings or a top safety pick. But the thing is, they're using a crash test dummy that generally is the 50th percentile male. And so we know women and older adults are not the same as a 50th percentile male. Today's average female is 5.4 inches shorter, 27 pounds lighter than the average male. As a result, females may sit closer to the steering wheel. They may wear their seatbelts differently from males. But the differences aren't just about shape or size or position. If you just think of our anatomy, the female pelvis has a geometry that's different from the male's pelvis. The male neck is stronger when it comes to forces that bend it. And so the fact that we don't have a representative average female, despite that we're at 50% of the drivers out there, and the best, kind of solution that they have for that is to use a 5th percentile male to represent women, is a problem because manufacturers designed to this test and we're not as protected as we could be in crashes. And so I think this is a really good example of kind of these hidden disparities in transportation. You would think if you and your partner are sitting in the front seat of a car, you both have your seatbelts on, you both have the same potential, kind of outcome. You don't.
Wow. So you're saying a bunch of men designed a testing system that only took into consideration an average male body.
Yeah, it's kind of crazy to think about that. In Europe, they are using some female dummies. And some companies have designed, for example, their head restraint systems so that they're better for women in whiplash. But,
wow.
It's not consistent and it's not across the board. And I would say regulation and requirements often drive change. And we really don't have good requirements in this space.
That's too bad. So one thing I noticed is that you say crashes and not accidents. Tell us why we should be saying crashes and not accidents.
Okay, so this is kind of a real pet peeve among transportation safety people, particularly those on the highway. I remember I actually went through a course, a child passenger safety course, focused on how to install car seats properly. And they had kind of like a jar in the front of the room that was almost like a swear jar. And if you ever said accident, you had to go put money in it.
That's good.
So they really try to break people from saying accident because when you use the word accident, it's almost as if there's nothing you could have done to have prevented it from happening. It's an act of God. It's random. But the reality is every single fatality on our roadway is preventable. It's preventable. Take alcohol impairment. That's a judgment that people are making, a choice that people are making, get behind the wheel impaired. There's a number of different ways to stop that. But again, it's preventable. People running red lights, paying attention, stopping, using technology, those are preventable. And so the list could go on, but knowing that these events are preventable, using the word accident is almost as if it's a get out of jail free card when something occurs. You are responsible for what happens behind the wheel, and people don't take that as seriously as they need to. And so accident really, I think, adds to this complacency that we have in the country about crashes.
Yeah. That's something that we can all take into consideration as we, talk about crashes in our communities, because it's something that I only learned from. There's a really great podcast called The War on Cars. And so that's where I learned it. But I think it's something that, media could take into consideration to help us better frame this problem that, as you said, is the third leading cause of death in the US. We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So let's move on to solutions. I have a couple that I'm thinking of and want your feedback on all of them. They're the ones that, you kind of hear about and first come to mind. So first, I would say, let's talk about autonomous cars and what they do for road safety, and if computers can drive cars more safely than we can.
Yeah. So, okay, full disclosure here. I worked as the chief safety officer of Waymo, which you shared, and I also was on the board of Velodyne, which manufactures LiDAR systems. I don't work for either of those companies anymore, but definitely want to make sure that people, have some transparency and make sure people know that I have a background in those spaces. I am so excited about autonomous vehicles, and I was excited before I went to work with these companies, particularly because for decades I've seen the intractability of some of these human factors issues that are really challenging for us to solve. And we actually, for the most part, haven't done a very good job with them. And so alcohol impairment's a great example. About a third of our fatalities involve alcohol. We just have not been successful in separating particularly the hardcore drinking driver, the high recidivist driver, the person with the high BAC who may have multiple DUIs. We've not separated them from their vehicles. And when you think about it, and again, this goes back to healthcare, this person has an addiction. If they're an alcoholic, they probably do a lot of things while they're drunk, while they're impaired. And so separating them from their car is one thing we haven't been successful at. And so if you think about automation, whether it's distraction, whether it's fatigue, whether it's alcohol, cars will not make those same errors that humans make. They won't fall asleep. They won't be distracted or impaired. They're really good at rule following. If there's a stop sign, if there's a red light, all of those things. And so there's tremendous benefits. We really can, 94% of crashes are attributed to human error. We can kind of take those out of the equation. But I'd say on the flip side, it is also a new risk for us. There's new failure modes with technology. There's a learning curve. There will be errors. There will be design errors, programming errors. There will be failures. Will they be, will the failures result in a fatality count as high as what we have today? No, I don't think it will. I think we're going to reduce fatalities. But we have to have the ability to kind of understand what those failures were and fix them, right? And then for people to have confidence in the technology.
Well, we have more sympathy for human error than computer error. I mean, anytime a Tesla is in an accident, it's front page of the New York Times.
That's right. That's right. So, and I think it's important. It is important to have scrutiny on these events in the early days, right?
Yes.
So it's good to have that scrutiny, but I think it's just realizing how out of proportion it is with all of the other fatalities that occur. 100 fatalities occur every day on the roads, and we just don't get as excited as we should about those. I don't have a problem with us getting excited about the technology failures. I just wish we'd get as excited about the other failures.
Sure. So, I mean, putting it into context, like, yes, this accident occurred, but compared to driver hours that are powered by humans, there have been fewer accidents in autonomous vehicles.
Yeah, and those are things that we can, by and large, fix, right? And so if you find a failure in your fleet, you can put out a fix that can actually fix that failure across the whole fleet. We can't really do that with human beings, right? You catch one person being distracted or one person falls asleep. That doesn't prevent every other human from making the same error.
Yeah.
But I think the big challenge here is people want these autonomous vehicles to kind of where we can wave a magic wand and suddenly we're not going to have any more fatalities on the roadways. People own their cars for a long time. It's going to take a really long time to turn the fleet over, even when the technology is mature enough to get to that point, which is not today. And so you think about this, we're going to have decades of mixed use roadways where we have some human drivers and some autonomous vehicles.
Yeah. Unless we can retrofit cars. I mean, that sounds like a good solution. Any car can be autonomous with, this little $2,000 device that the government pays for.
Well, if the government would pay for it, I'm not sure that's going to happen. But, I do think there's a huge public benefit, right, to getting to this point, to accelerating this transition, the technology transition. But this mixed use period is actually going to be really complex and very complicated, and actually is harder for the autonomous vehicles because humans actually don't obey rules. And so you have people who cross over the double yellow line, or you have people who run, red lights, and so that's harder. That lack of rule following is harder for autonomous vehicles than for humans. And so, for some humans, right? You've got the distracted and the impaired and maybe people who aren't as proficient drivers, both at the beginning and the end of the spectrum. And so the autonomous car is probably going to be better than most drivers on the road, but in certain unique situations, human beings still are very good at recognizing very unusual situations that they've never seen before and figuring out what to do.
Yeah. So you mentioned, human error, a lot of that attributed to driving while impaired. What have you seen that works for lowering incidents of drunk driving? Is Uber and Lyft, is that making an impact? Sobriety checkpoints? As someone who has been impacted by a drunk driver, my health, my mobility, my sanity from the amount of paperwork involved, I'm very personally motivated to see this problem solved.
Yeah. And Hallie, the first thing just to say to you, I'm so sorry that happened to you. I'd say there's so many innocent people every year that are impacted, and I'm thankful that you're doing well.
Yeah.
There's a lot of people, the 10,000 deaths are just the tip of the iceberg.
Yeah.
185,000 people are severely injured, life-altering injuries in impaired driving crashes. And so, the toll is very high. I would say, definitely sobriety checkpoints have a deterrent effect. And so that's important. There are ignition interlocks that work for people who've been convicted. That's where they have to blow to make sure that they aren't impaired. Those have been very effective for people who have been convicted. But I would say, with respect to Uber and Lyft, we don't have as good of a story as I'd like to share. I mean, honestly, for me, I felt like this is the answer for a lot of people, but the data is mixed. There have been studies done in certain cities before and after Uber and Lyft, or maybe when there were cities that allowed them, required them to stop operating. And so kind of there's a before and after, but we don't have super good data. And I think it really goes back to the hardcore drinking driver and people who really will not avail themselves of Uber and Lyft. I think those of us who use Uber and Lyft after we've gone to a party or make plans to do that, we're also probably the people who would have made plans to use a designated driver or have alternative options available to us. And so I think that Uber and Lyft are a great option for mobility and allow people to take advantage of that. But I don't think we're seeing in the data the reduction in fatalities that we
That's too bad.
would have liked to see.
Yeah, that's too bad.
Yeah.
So this one's kind of a kooky one, but there is a movement out there that I found that talks about how we require motor helmets for, in some states, I guess, for motorcycles. And why don't we also require them for driving, since head injuries are so common? And I actually heard through the grapevine that there is a Silicon Valley executive of a famous tech company, I'm not going to say, who wears a helmet while driving. So this is, something that people are talking about it. Is that just like so bonkers that would never fly? We can't get people to wear seatbelts. We're not going to get them to wear a helmet. Or do you think it's something that could potentially make a positive impact on safety?
So I would say you hit the nail on the head. The seatbelts are still your best defense inside of a car. 50% of the fatalities are actually unbelted.
Oh, wow.
And our seatbelt use rate in the US is around 80-ish%. I think it depends on, what period of time you're looking at. But, and in some states, it's as high as 95%. So the majority of people are buckling up, but it still represents a high number of people who are killed. So seatbelt use important. I would say many cars actually lack the headroom to accommodate a helmet. And so I think that would be challenging. But, our family's a big fan of F1. And, those drivers clearly have a lot of safety devices. The helmet is a key part of that. But on a funny note, my youngest son, when his older brother got his driver's license the first time he had to ride with his older brother, he got into the car with his bike. I think more just to give him a hard time than anything. But motorcycles, bicyclists, I would absolutely advocate for helmets. I don't know that advocating for helmets in cars is a battle that's worth fighting. I'd rather get everybody to buckle up.
Seatbelts, yeah. Okay, so talking about teenagers, we know that they're overrepresented in car crashes, and maybe we're just not teaching them how to be good drivers. What is GDL? And do you think it can help reduce fatal crashes?
So GDL stands for Graduated Driver's License, and it has been around for decades, and it's proved very, very successful. We've actually driven down the teen fatality rate because of some of the measures in GDL that are data-driven and proven. So some examples of those are having a longer holding period during your learning period. So when you have your permit, really driving with your kids more. And so some states have minimum hour requirements for daytime driving and for nighttime driving. And so it's so valuable to just be in the car with your child for more hours. I think when I'm older than you, so when I was young, I don't think my parents ever hardly went out driving with me. They did, but not like we've had to go out with our kids as they've learned, 50, 80, 100 hours. And it's very valuable. There's a few other provisions that the GDL puts in place. Passenger limitation. We know that having other kids in the car, so 4 kids in the car, you're 4 times as likely to be in a crash. And I think we can all think back to risky behavior we did when we were being egged on by other kids in the car.
Yeah.
Distractions. So most states actually have limitations for kids when they're in their driver's phase or under a certain age, not to use cell phones. So that's an immediate penalty for them.
Mm-hmm.
And then I'd say nighttime driving restrictions is another good example that is used in the graduated driver's license where kids don't drive at night. So it's more risky to drive at night. In reality, the first 1,000 miles are the most risky for kids. And it's not because necessarily that they have bad judgment. They're just inexperienced. They don't know what they're doing. They're learning. And so more kids in the car, cell phones, all of these things, when you don't have a really good grasp of what you're doing, just makes it exponentially harder. And so GDLs have been effective across the states. I'm really grateful for them as a safety professional, but also as a parent, because it gives you a roadmap of how to do things better.
Mm-hmm. Yeah. So we talked about autonomous cars, helmets, sobriety checkpoints, better, GDL for teenagers. What am I missing? What other solutions do we have in our toolbox that could actually make an impact in the space?
I'm really bullish that we can drive down fatalities by doubling down on the things that we know work, embracing that safe systems approach, and accelerating our use of technology. I think many of us who have newer cars see the advanced driver assist systems that are stepping stones to automation. They are showing really good promise in cars as being effective. Everything from lane departure warning systems to automatic emergency braking to blind spot monitoring, all of those types of technologies can be very helpful. And so I think that's another piece that helped aviation really do better, was having that advanced technology to try to overcome the human error in the cockpit. And I'm hoping that same approach can even be applied to our roadways and we can do better.
I'm glad you're optimistic. So taking a step back, tell us about your background and what ultimately led you to this work and becoming an expert in this space.
I'm one of those people who I've just been so lucky, and I know that you probably feel the same way. My life is not what I planned when I was younger, but I couldn't have imagined kind of it turning out better. The first decade of my life, I got to spend on Capitol Hill working on transportation legislation. The second decade, I spent at the National Transportation Safety Board investigating transportation incidents and learning. It was like solving puzzles, like being the Nancy Drew of transportation. And it was so even though it's a very sad environment to work in, there's so much good that comes out of it. You improve safety for everybody by learning. The third decade was really focused on not-for-profit work, and then also working in for-profit companies. And so I really got to see different sides of the coin. And that was very informative to me, because I think we all have the experience. If only I'd known in my last job what I know now, I would have done things differently, or I would have done things better. I feel like my whole life, I've gotten to be a student of things. I've gotten to sit at the feet of the masters and learn from people who are smarter than me. And it's never felt like I've worked a day in my life. Honestly, I've loved every minute of what I've done.
Yeah. And you've worked on several pieces of milestone legislation. Which one are you most proud of, or you think has made the biggest impact in the country?
Oh, that's like asking me to pick which one of my children is my favorite.
The next question.
I feel so lucky. I got to work on passenger rail safety legislation that resulted in more emergency windows, better access for emergency responders. I got to work on pipeline safety legislation. But I think the one thing that was really a missing piece that I had the chance to work on was creating a new modal administration at the Department of Transportation focused on truck and bus safety, because they were kind of buried in the Federal Highway Administration. No one was really highlighting or paying attention to the safety of trucks and buses on our road. And that is something huge. I mean, there are 4,000 people killed in crashes every year. And that's an area that needs a lot of attention. We have more commercial truck drivers than we do, bus drivers or airplane pilots. And so having an agency that's specifically focused on that industry is really important.
Yeah. What is the Road to Zero coalition that you worked on?
So this was a really fun period of time in my life. The 3 Department of Transportation agencies, the National Highway Traffic Safety Administration, NHTSA, the Federal Highway Administration, FHWA, and the Federal Motor Carrier Safety Administration, which I just mentioned, is that truck and bus agency. They all got together. I was leading the National Safety Council at the time. And we created this Road to Zero coalition, which the National Safety Council managed. And we had, 1,000 members who were focused on trying to get to zero fatalities on the roadway. We created a report with the RAND Corporation based on a lot of stakeholder input, put together policy statements that I'm very excited to see now are in legislation today. There's a number of pieces that have been approved, and then the transportation bill that's been debated. There's a lot of focus in that space. So it's been exciting to see a lot of that mature over time. But the Road to Zero is really focused on creating that safe system.
You love systems.
I do. And you know what? I think some of that is because when we investigated events when I was at the NTSB, people always want to blame one thing. And, if there's a plane crash, very often the first thing that comes out is they blame the pilot. It's pilot error. But, there's a reason why you get to that crash. And it usually is multiple factors. It's not just one thing. It's a system that allowed it to get to that point in time. Either there weren't adequate controls, there wasn't adequate training, or there wasn't communication. There wasn't the technology needed. Somebody hadn't upgraded, something that was required. There was a failure of a part. It's always more than one thing. And so I think that's why I embrace that thought process so much, because we always want to go to lowest common denominator and simplify things, but things that are complex usually aren't simple.
Yep. I absolutely agree with that. So, I consider you part of the healthcare community because you work on safety and saving lives. And we all face naysayers in healthcare. Tell me about the biggest roadblock that you faced in this work.
You know what? This is something that I'm a little bit sad to even declare or share with you. We still allow lap-held children on airplanes. 40 years ago, we got car seats in cars. We now have booster seats for our kids. All 50 states have laws requiring safe transport of children in cars. And the physics don't change, whether you're in a vehicle that's going 50 miles an hour or 500 miles an hour. We all buckle up on the airplane. We tell people to put away their laptops, secure the coffee pots. But the most vulnerable thing on the airplane, a baby, a lap child under 2, is not restrained. And I worked for a long time to try to change that. And it's so disappointing to me that the reason why it wasn't changed was because of the cost benefit analysis. It's not the right thing to do. It's not the right thing to do. And by having that rule that allows that, you give parents kind of the impression that it's okay, but you're not protecting your child. And I think most parents, if they were given a choice, would never put their child in a less safe position than they are. There's turbulence. Airplane crashes are survivable. Look at the miracle on the Hudson, no engines, both engines were lost and they still were able to get the plane down. There's multiple examples of people surviving plane crashes, but just like in cars, proper restraint is kind of a key tenet, of that system that makes it safer. And you're just not providing that protection to those babies. And that will forever haunt me that I wasn't able to kind of make the headway in that space. But I know that one day it will change. I hope I'm still around to see it.
So I had no idea. When my son was under 2, I flew with him on my lap, and I, as you said, assumed it was safe because it was allowed. I wonder if there's more of a public health campaign that can, approach parents to let them know that, it's safer to have the child in the car seat on the plane.
Yeah, we tried that. I think we weren't able to penetrate, and I think it's hard. It's the economics of it are hard. It's almost an incentive. And Hallie, do not feel bad. I flew with my first child on my lap, and after I went to the NTSB and learned about this issue, of course, I became an evangelist for it, and I never did it again with my other kids. One of my sons was born while I was at the NTSB. And, I talked to all of the other parents that I knew and people now, grandparents and things like that. But, it's just really interesting because psychologically, I think we're all smart enough to understand that it's not something that makes sense, but, it's so easy. And, but, honestly, this too, once the child is like mobile, once they're like 9 months to 2 years, it's almost really challenging to keep them in your lap. Yeah. And so having that car seat on board is not just a safety thing. It's keeping them kind of in a seat.
They put everything in their mouths or like licking the back of, the seats.
And terrorizing all the other passengers. Too.
So I wonder if we'll look back at this the way my mom tells stories about, in her generation, they'd put children in the floor of the back seat of the car.
Yeah. I remember my little sister sitting on the armrest in between my parents on the front seat so she could see.
That's like horrifying. So maybe we'll look back on this someday.
I hope so. Hallie. But, I think it's occasions like this and opportunities just to have the conversation to me that, I think a lot of people do change behavior when they know, but, but that's why it just goes to show you the laws and the regulations are critically important.
Yeah. So if people are interested in learning more on the topic of road safety, what resources should they look into and how can they follow your work?
Yeah, so there's a lot of great resources out there. The National Safety Council, an organization that I used to work for, has a number of resources. They have information about the road to zero. They have information about injury facts. They rank the leading causes of death and lots of other information that is really interesting to people. There are a number of websites out there. If you just Google safe systems, you can find more information out about that. And if they want to follow me, I'm on LinkedIn and Twitter, Debbie Hersman. And I'd love to stay in touch with you, Hallie. And I hope that everything goes well. And in 12 years that you'll be doing a good job with graduated driver licensing or autonomous vehicles.
Autonomous, yes. Well, if it's up to my husband, we're going to live in a city where we don't need to have a car. He's been trying to get us out of the suburbs.
Well, and that is another huge thing, right? There's a big difference between fatality rates on buses or light rail. Yeah. And so, using public transportation can be a benefit. But I'd say those pedestrian and bicyclist fatalities, vulnerable road users, that's something we've got to figure out because we want to get more people off the road and have them be healthier, being mobile, exercising. But we don't want them to be put in harm's way to do that.
Yeah. I mean, this has been a fascinating conversation because as you have said several times, these are preventable deaths and it really takes, the systems thinking and policymakers, manufacturers to kind of come together because we know how to fix this problem. Unlike, cancer and heart disease, we have, there are other risk factors, genetic risk factors, lifestyle risk factors that are a lot harder to change. So we could really be improving health outcomes overall in America if we're able to take this more seriously. So Debbie, thank you for joining us today and sharing your wisdom and insights on road safety. And thank you to everyone for tuning in. If you haven't yet, subscribe to the Heart of Healthcare wherever you listen to podcasts. Thank you.
Thanks for listening to this episode of the Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.